My name's Shyoli Iradufasha, Théodosie, Dalie, and I'm 20 years old.
Without taking much time, I would like to describe what is family planning. Family planning is the practice of controlling the number of children one has and the intervals between their births, practically by means of contraceptives or voluntary sterilization.
Myself, as an active member of Rwanda Girl Guide and a responsible citizen, I felt concerned about family planning since I was too young. This has been due to what I grew up seeing around me. A family of 8 or 10 children shared a shelter of 1 or 2 bedrooms. It was really hard for them to get their right to health care, recreation, and above all, education. I decided to not keep quiet. I knew my contribution was not enough to change all people's mindset, but I was pretty sure that I'm doing a contribution to a better world. For 4 years now, I've been sensitizing people to break the barriers, join health centers, and get the family planning of their choices and live sustainably. I encourage my fellow girl guides to join me in this, and some are also doing the same. I didn't forget girls adolescent, now that we are facing a big challenge of early pregnancy among Rwandan girls. I realized that breaking the silence and talk more about reproductive health and family planning specifically would be for a help for those girls with parents who can't tell them anything due to culture norms. Today, girls are more confident to talk about questions about family planning and make sure if they can't abstain, at least they use all means of protecting them. Resources, into policies, attitude services, and education to give men and women the ability to avoid unintended pregnancy and choice to have a child is good looking at social, political, economics, and environmental aspects. The way is still too long, but I won't stop until this is no longer an issue. UNFPA and the Gatmacha Institute say that serving all women in developing countries that currently have an unmet need for modern contraceptives would prevent an additional 54 million unintended pregnancies, including 21 million unplanned births, 26 million abortions, and 7 million miscarriages. This would also prevent 79,000 maternal deaths and 1.1 million infant deaths. Furthermore, the remaining poor families constitute of those with large families with many children, clear indications that if people moderate unplanned pregnancies, their little revenue can support them few months to feed and empower themselves economically. Continued use of contraceptives has facilitated the regression of HIV, AIDS, and other related cases of sexually transmitted diseases due to the use of condoms. The number of deaths related to childbirth have been curbed thanks to family planning. You can also do something. You can save 1 or 2 lives around you. You can secure the right to education of 1 or 2 individuals through sensitizing and supporting family planning. Come on, let's join hands and make this happen.